subject, the irrigation and accidents, how to prevent and how to manage. You can see it also on my page, and on we shared it on several pages. So it's great to be with you today. Yes. So let me remind you with the goals of endodontics. The main goal of endodontic is to remove all the vital and necrotic tissues, micro and microbial byproducts from root canal system. So we want to eliminate or reduce the number of bacteria from the root canal system, and then we want to seal it, and we hope after a while healing will occur. This goal can be achieved through two things, either mechanical and chemical debridement of root canals. So we will depend on the manual files, mechanical files, and also we will depend on the chemical products, which we call them irrigation. So mechanical part is not enough, chemical part is not enough. We need both of them to achieve such goals. But why mechanical part is not enough? Why we need to irrigate? According to Peter, he made a study in 2001, and he said all instrumentation technique, it will leave about 35% of the walls or the canal surface untouched or unchanged. That means in such a case where you can see here the green part, it's before instrumentation, and the red part after instrumentation. And you can notice here a lot of a green part, which means untouched canals. That means they contain a lot of debris, bacteria, and those areas could not be reached by instruments. So how we want to clean them? By using irrigation. Another thing, as for oval canals, the amount of untouched surface area after preparation has been shown to range from 10 to 80%. You can imagine in case of canine, which has an oval canal, this is the green before instrumentation, and this is the red after instrumentation. That means about 80% of the canal's walls are untouched. So how to eliminate debris and necrotic tissues? By irrigation. So this will show us the importance of the irrigation during our work. So we have to believe irrigation remains the most significant step in endodontics. So we have to spend more time and we have to take care of irrigation. And the problem nowadays, we can prepare the central incisor by mechanical or rotary instrumentation within 3 to 5 minutes. But that means the tooth is well prepared, but it is not clean. We have to spend more time in irrigation to get a clean canal. And the most frequently used irrigant is sodium hypochlorite. And today we will focus more on sodium hypochlorite because it's the major part of our irrigant protocol. So sodium hypochlorite, the story of sodium hypochlorite during the World War I, a buffered 0.5 sodium hypochlorite was used to wash and disinfect infected wounds. Then these valuable properties have encouraged the use of liquid sodium hypochlorite as a basic irrigation solution in endodontics since 1920s. In 1954, Lewis suggested we can use Clorox, the bleaching material which we use in our home, 5.25% as a source of sodium hypochlorite for endodontic use. Until this moment, we are using Clorox. We buy it from supermarkets, we take it to our clinics, and we use it directly inside the root canal to disinfect them. So we have to know why we could not find other alternative than sodium hypochlorite, the benefits of sodium hypochlorites. So let's see. The first advantage of sodium hypochlorite, it is tissue dissolving. The ability of sodium hypochlorite to dissolve organic substances, necrotic and vital organic tissues is well known. So it is the only solution in the irrigants which has the ability of dissolving organic tissues. If you use saline, hydrogen peroxide, chlorhexidine, EDT have such properties. And this is from Castellucci in the Don textbook. If you insert vital tissues inside a dish with sodium hypochlorite, you will find the pulp will disappear. That means the sodium hypochlorite is a potent dissolvent. The second advantage of sodium hypochlorite, it acts as a lubricant. So sodium hypochlorite used to reduce the friction between the endodontic instruments and the canals. So this will reduce this friction, and that means it will facilitate the movement of our files. Another thing.
Thank you, Dr. Mohammed, but I have a technical issue coming from your side. If you have more than one device that is broadcasting or that's recording the lecture, if you can turn them off because there's a delay in the as we have received.
So okay.
Maybe the internet is a little bit slow or something.
Now you can see I reached to the third benefit, which is disinfectant. You can see it or not yet? Dr. Hassan?
Yes, I can hear you.
So shall we continue or
yes,
what?
Please.
Okay, so the third benefit of sodium hypochlorite, it has shown to be potently bactericidal against gram-positive, gram-negative bacteria spores and microorganisms and viruses. So the second question is, what is the concentration of sodium hypochlorite? The appropriate concentration for sodium hypochlorite is a matter of much debate and remains controversial. Unfortunately, there is no consensus as to the most effective concentration of sodium hypochlorite when used as endodontic irrigant. We don't know exactly which is better, to use low concentration or high concentration. Because of this, there are many authors, they recommend a 5.25 concentration of sodium hypochlorite, which means full concentration of Clorox. Yeah, that means you can use Clorox as it is without any dilution. Others, they prefer a lower concentration from 0.5 to 3%. So we don't have a general agreement regarding the concentration. Personally, I prefer to use full concentration, which is 5.25, and I believe it will give me better results. Now, how do we irrigate the canals? How we can take our solutions inside the root canal system? And let me remind you, we are using sodium hypochlorite to remove the organic materials. We use ethylene diamine tetraacetic acid or EDTA to remove inorganic materials. And we use chlorhexidine to kill the E. faecalis, which is the gram-positive anaerobic bacteria. So because of this, we have to know how to irrigate. Actually, we have two approaches for irrigation. The first approach, it's called negative pressure, or the commercial name is Endovac. We are using a certain device, and this device is used to place the irrigant inside the pulp chamber, and then this irrigant is drawn down inside the canal and aspirated by cannulas. So irrigant is delivered inside the canal chamber. Then a macro cannula equivalent to size 55, taper 2%, remove the coronal debris. So let's see this from the using a video of Endovac. This is a tooth. After instrumentation, we want to make irrigation, so we will place irrigant inside the canal. Then I will use a macro cannula, 55 the size, the taper 2%, for 20 seconds to remove the debris from the coronal 2/3 of the canal. Then we will go to the next step. Subsequently, I will use a micro cannula, which is equivalent to size 32, taper 2%. This will remove the particle lodges at the apical part of the canal. So the next step, we will use micro cannula. This micro cannula will aspirate the debris at the apical part. And by doing this, we are removing the maximum amount of debris and bacteria from the apical part. Why we are not using only micro cannula? Because the debris at the coronal 2/3, it might block those tiny holes at the micro cannula. So we are using macro and micro to remove all such debris at the apical part. Why such device is recommended by some? Because its main characteristic of this system is safety. They said the irrigation will not be extruded outside through the apex because we are aspirating it. Because of this, the risk of expulsion or accident is less. Don't use cars because we have a high possibility of making accidents, and instead of this, use bicycle. So personally, I believe this is not the proper solution. The proper solution is to know how to use the second approach properly and reduce the possibility of the accidents. So the second approach, which all of us are using in our clinics, is positive pressure, which means syringe and needles. Positive pressure means we are pushing the irrigant inside the canal, and we will use the suction to aspirate it. So we need syringe and we need needles. Because of this, we have to know what types of syringe we have to use and what types of needles we have to use. So let's see the syringe. We need a syringe which is 5 ml for endodontic irrigation, and the head of the syringe must be lower lock. Dr. Hassan, are we fine with the...
Yes, everything is great. Just if you can improve if you can disconnect any other Wi-Fi devices, maybe that would be better, because we have a couple of complaints about. But I'm checking on another devices. It works fine. I don't know. Maybe some people are finding some difficulties. So if you can do that, would be great. Otherwise, you can just continue. It's okay.
If I ask my kids to turn off the internet, they will kill me. So
they will come to the
okay. So we need the syringe, which is 5 cc, and we need the needle, which has a gauge 30 needle, and this needle is 0.3 millimeter, the diameter. And this needle, which is special for irrigation, we could not use the intradermal needle because it has gauge 22, which means 7.71 millimeter is the diameter. That means it will reach to the half of the canal. So we need a special irrigating needle which has a gauge 30, and this needle will reach to 1 to 2 millimeters from the working length. Now, how much I have to press the needle? According to Basirani, she said the flow rate at least up to 0.2 to 0.25 milliliter per second, which means every 1 ml needs about 5 seconds. That means the syringe it will take between 20 to 30 seconds. So take your time while you are making your irrigation. And at the end of our irrigation, we recommend to use ultrasonic agitation using ultrasonic tip. This will increase the activity of sodium hypochlorite in the apical third of the root. So we, at the end of our work, we have to take we have to take ultrasonic tip and place it at the 1 to 2 millimeter from the apex. Then we have to activate it to 60 seconds for each canal. Then we have to activate for 1 minute in each canal, like this here. We just activate inside the canal for 1 minute in each canal. And this will give us excellent performance for the canal irrigation. So this we do the irrigation at the end of our preparation, not at the beginning. Why? Because we need space. Because of this, we have to make activation at the end. Great. So when we have a necrotic tooth, my protocol is to use sodium hypochlorite for 30 minutes. Every 3 to 5 minutes, I will use 5 cc. Then I will activate with my ultrasonic tip for 1 minute. And then I will use EDTA for 1 minute in each canal. Then I will activate. Then I will irrigate with saline to remove any remnants of, I will, after EDTA, I will use sodium hypochlorite for flushing. Then I will use saline to remove any remnant of sodium hypochlorite. Then I will place chlorhexidine, 2%. And in each canal, I will leave my chlorhexidine for 2 minutes. Then I will dry and then I will fill. And let's see the follow-up after 1 year. The best sodium hypochlorite antimicrobial effects are observed when the substances is regularly exchanged and used in large volume. So you have to remember those 2 points. We have to exchange. That means every 3 to 5 minutes, I have to use 5 cc. Why to exchange? Because the sodium hypochlorite, it will lose its effect after interacting with organic material. So you have to use fresh sodium hypochlorite. And we need large volume. So 5 cc is not enough. We have to use good amount of sodium hypochlorite. How much sodium hypochlorite? How much the time? Unfortunately, we don't have definitive answer. Buchanan, he recommends to use sodium hypochlorite for 30 minutes. But we don't have definitive answer. We don't have exactly what is the time to make proper irrigation. Now, during irrigation, remember, the needle should be moved apically and coronally. Don't stop moving your needle, and you will know why after a while. And with slight movement. Why we do this like this here? We are irrigating a lot, and we keep moving our needle. Such movement has 2 advantages. First, it will produce agitation, so it will activate our sodium hypochlorite, and it will prevent binding of the needle, so our needle will not stuck inside, so it will decrease the risk of the accident. So, the most important part in this lecture is the following. It is important to have the needle free in the canal. So, there is always space for the irrigant to escape in the coronal direction. And the word free inside the canal is the key point in our lecture today. So keep your needle free inside the canal and don't make it stuck inside the canal. What will happen if there is extreme pressure during the irrigation, or if our needle stuck inside or bind inside the canal? So there is no release for the irrigant to leave the root canal coronally. And I believe personally, there are two reasons to have irrigants. First, excessive pressure. Second, our needle stuck inside. I don't believe over enlargement of the canal or wide apex, it will cause irrigation accident, because I'm using sodium hypochlorite, full concentration in open apex. But I am concerned while I am irrigating slowly and gently. So the main causes for accident is excessive pressure and binding of the needle inside the canal. So if irrigation accident occur, it is always because of us, not because of the anatomy, not because of the patient. It is because of us. It's dentist error, because excessive irrigation or he was in hurry, the needle is stuck inside. So if irrigation accidents happen, what will happen? You will see several symptoms while, or several signs while the irrigation accidents occurs. When you see such signs, you will know you have accident. First, sudden severe pain. So your patient might shout while you are irrigation. So the severe or acute pain is the first sign. Second, profuse hemorrhage from the root canal. So a lot of bleeding is coming from the canal out of sudden. When you see such a bleeding, you know you made accident. Another thing might happen, development of rapid swelling. So you will notice there might be a swelling at the cheek of the patient or at the area where you are irrigating. Within a few seconds, the signs of hematoma or ecchymosis of skin are shown. And remember, it is not always all those signs occur, but if one of them occurs, bear in your mind, you might have accident. So hematoma and or ecchymosis of the skin. And the mode of spread was associated with anastomosis around the facial vein that permitted the rapid spread of sodium hypochlorite. So sometimes you are irrigating at the upper left canine, and you might see the ecchymosis below the orbit, or it will go to the cheek. So you can see here the ecchymosis or the hematoma which occurs due to sodium hypochlorite accident. Intraoral ecchymosis might be observed. Sometimes you can see it intraorally here. All of what I am going to show you today are my cases and my accidents. And of course, we are learning from our errors. So I was irrigating the canine, and out of sudden profuse hemorrhage occurred from the canine, and you can see the ecchymosis which occur here. Another thing, possible extension of edema over the injured half side of the face. Sometimes the swelling might spread to the half of the face. Another sign might occur. Your patient might tell you he might feel a chlorine taste and irritation of throat after injection, particularly if you are treating upper premolars or molars, which they are so close to the sinus. Unfortunately, sometimes they might feel anesthesia or paresthesia. Fortunately, this is reversible. Irrigation accident is a true complication. I think it is a nightmare, and it will undermine clinician-patient relationship. So sometimes your patient might come to you a second day or the third day, and you can see with his face discoloration and the change of the color, and he will be angry and surprised why it happened. I picked this from the page of Dr. Ziad Al-Ani. He mentioned this, a mother, 31, whose mouth was burned with bleach during root canal treatment, and they said she wins 7,000 pounds in compensation. So you might be liable for suing. So you have to take care of this. Now, let me show you two cases. I have during my life about 8 to 10 cases like this here, and just I want to show you two cases because most of them are the same scenario. This patient, she came to my clinic for treating upper left second molar, and it was single canal, so simple. So I finished my shaping within 3 minutes. Large canal, and this is the master cone. So after 3 to 5 minutes, it was finished. So I started irrigation every 3 to 5 minutes. I use sodium hypochlorite, and I will wait. Then 5 cc, then I'm waiting. Then 5 cc, then I'm waiting. Then out of sudden, severe pain occurred. Severe bleeding started. And instant swelling occurred, unfortunately. So when I saw such signs, I knew we have irrigation accidents. So there are 3 questions to answer. What shall I do immediately? What I have to tell the patient? And what I have to expect during the next 2 weeks. So what shall I do immediately? I always advise my colleague, remain calm and control yourself and your emotion. You are here to help the patient, so you have to stay calm. Next. Because the patient is feeling a lot of pain, we have to control the pain. So local anesthesia is recommended. Give the patient local anesthesia. Next, I have to dilute the sodium hypochlorite. So I will irrigate with saline slowly and gently for a few minutes till the bleeding stops. So now my patient is feeling better. There is no pain and the blood stopped. So next step. If you finished your work and if you can dry the canal, like this case particularly, I will fill the root canal system because there is no additional value to wait more than this. If you can dry the canal, you can go and you can make your final operation. Now, the second phase, what shall I do in the office? We have to inform the patient of the cause and nature of the incident in a smart way. You can tell your patient, unfortunately, there is a sort of reaction happened due to sodium nitrate, and this reaction might have certain consequences, as we will see here. So inform the patient and tell the patient what will happen after a while, because he will face a real trouble after going home, as we will see here. Now, what we will tell the patient is the following. When you go home, I want you to apply extraoral cold compress for reduction of swelling. So today, apply cold ice on your face to reduce the swelling. Then tomorrow or after one day, I want you to apply warm compress and frequent warm mouth rinses. Why? Because I want to stimulate local systemic circulation and activate vascularization. Next, what about antibiotic? Is it necessary? It's not obligatory. Only in cases of high risk or evidence of secondary infection, but we don't give it as in a regular base. Like this patient here, I did not give her antibiotic. What about antihistamine? The administration of antihistamine is also not recommended. It's not obligatory. You can or you could not. It's not obligatory. Another thing. What about corticosteroid? It's controversial. Dexamethasone injection, it's controversial. There is no general agreement to give or not to give. What about referral to hospital? In case of worsening symptoms, we might refer it to hospital. يعني alhamdulillah, in the 10 cases which I saw during the last 15 years, no one went to hospital. So I don't see any necessity to send him to hospital if there is no severe symptoms. Now, the most important part is coming. We have to reassure the patient that this complication will not affect the success. We have to recall the patient daily to monitor recovery and to reassure him. Let your assistant or you can call the patient to reassure him, because we want our patient to feel calm and to feel he is cured. The patient should be informed that healing will take some days, and I mean by healing, back to normal. The main problem of irrigation accident is the skin discoloration or ecchymosis. So it needs time. So we have to inform our patient this will take time to back to normal. And what is this time? It might take 2 weeks or even more. And that symptoms, in most cases, they will resolve completely. So let's see this case. This patient, she was so cooperative. She accepted to take selfies for her face during 2 weeks to show me what will happen during those 2 weeks. So I will pick some pictures and to inform you about the progress of this accident. So this is after 6 hours. You can see here the discoloration and the swelling. One day, you can see more change of the color of her face. Now you can see after 2 days, we have blue and red color, and the ecchymosis here is so clear. After 4 days, it spreads more. Now after 7 days, we reach to the peak and we are going down, so it's regression. After 2 weeks, everything back to normal. The second case, it's for this premolar, and this premolar is for a lady. She was 70 years old, and she came to make root canal treatment. So it has 3 roots. So while I was making the treatment, the blood was coming. When you see the blood is coming out of sudden, that means you are in a real trouble, because the accident happened and the worst is coming. So I irrigate with saline for 10 minutes, then the bleeding stopped, then I continued the working, and I could dry the canal, and you can see here the obturation. So look carefully at the date. It's 25 May. Let's see the patient. She went home. I told her about what might happen and the discoloration and the swelling. I gave her anti-inflammatory and painkiller. And one day after this, 26th, she came with severe discoloration of the skin, ecchymosis and hemorrhage. If you can see here, hematoma, and it spread. It was only upper right first premolar. So you can see the spread till her neck. So now you have to know about the accident. You could not reverse the accident. It happened and it will continue. And what you can do, you can just reassure the patient. I told the patient when she came back, as I told you, it might happen and this needs a time. What you have to make today, you have to place cold pack. Tomorrow you have to place the warm pack, and you can rinse with mouthwash, and you have to wait because we just have the need time to disappear. Let's see this patient after 1 week, and let's see this patient after 2 weeks. Everything disappeared and everything back to normal. But you have to take care. It is a nightmare for the dentist and for the patient. And the best thing to do is to take all the measures of prevention while you are making irrigation. The best thing which I can advise to you is the following: irrigate slowly. Take your time while you are irrigating, otherwise you might cause troubles. And for those, it's better to use chlorhexidine rather than sodium hypochlorite or just saline. It's like you don't want to use cars because you are afraid of accident. The better advice is use your car, but take care and all precautions, and be alert, be there while you are irrigating. Don't push, don't rush. And if it happens, control your emotions, control yourself, be confident, and good luck. Thank you, Dr. Hassan. Thank you, Dr. Mohammed, for hosting me today. And I wish for all of you to get the maximum benefits of this lecture.
Thank you very much, Dr. Mohammed, for the very informative lecture. It's great to see how you handle your own cases, because everybody who do root canal treatment will have at some point of his work experience hypochlorite accident. So it's great to hear it from you. We have a few questions, if you don't mind answering them live.
Yes, please.
First of all, why does bleeding occur, and how do you stop bleeding?
Bleeding, it's due to inflammation, and you know there will be the sodium hypochlorite. It will interact with the lipid inside, and it will cause hemorrhage, because of this inflammation, the bleeding, it's acute inflammation which might occur. How it stops? I use regularly the saline. Just I need time to stop the bleeding. And what I recommend for our colleagues, don't place cotton pellet till the bleeding stops. If it does not stop, spend more time. Because if you just place the cotton pellet over the bleeding, the patient, he will suffer a lot of pain, and he might spread the hemorrhage inside.
Okay, another question related to the same thing. When you have bleeding, do you irrigate to get rid of the bleeding with any other thing? You use hypochlorite as well, or you're using only saline to irrigate after you have the bleeding?
After a bleeding, now I want to dilute the concentration of sodium hypochlorite. I will use saline. Then when the bleeding stops and I want to continue, it depends where I reach in my protocol of irrigation. If in the middle, I have the gut to continue irrigating with sodium hypochlorite, but this time I will use it slowly and gently. And let me be clear with you, all my cases where I had accident, it was my fault, because there is always excessive pressure or the needle binding inside. So it's not the patient's fault, it's my fault. And this is, fortunately, we can avoid this by spending more time, and at the same time, be alert and focus while you are working.
Okay. And between visits, if you have to do it in between visits and you have an accident, what do you place inside the canal?
Just cotton pellet and temporary filling, nothing else.
All right. And do you use local anesthesia as well inside the canal to dilute what happened and to reduce the pain, or you use it as an infiltration?
No. Yes, I will give infiltration. I will just use saline inside. I will not push with because sodium hypochlorite and anesthetic solution, they will interact. So I prefer to just saline.
Another question: does normal saline or chlorhexidine can make any accidents?
In the literature, I did not see this. Saline, I did not see any case with saline. Chlorhexidine, it might, but most of the things in the literature, it's sodium hypochlorite, and I saw with the hydrogen peroxide, I saw one with EDTA. Frankly, I don't know about chlorhexidine, if it might. Why not? It might. It's irritating material if it goes outside the apex.
All right. And one more thing about the size of the needle. You mentioned that you use the size needle 30 most of the time, or all the time?
Yes, all the time. I use lateral point gauge 30, which means 0.31. Now we have a needle which has several holes at the lateral, but always we need the holes laterally. Because in this case, we are taken to the side of the canal, not toward the apex.
And regarding the most cases prone to the accident, are they upper or lower teeth?